Today is the last week for the VLE participation, and I will be sharing my views based on the criteria. The first is to share about the module overview, things that I have faced, challenges, and things and topics that are of my interest. So I will share more than the interesting things, more than the challenges. I have more of interesting learning that has taken place in this module. And first is I will share about the challenges. The challenges is sometimes we are not able to read a book due to some time constraint, and as well as in cases where we are not well prepared, or because we have the book for this module, so we're not able to understand the concepts well, but after being taught, it is easy to understand the concepts. And this is the only toughest thing that as an individual faced, because I have not read the book earlier before the lesson. Then the other interesting thing is the model itself is very interesting, because although we have the economics background, we are also not actually, it is not like we don't actually interrupt in the health system, where science students are mostly associated with. But however, even as an economics student, we got to learn about health economics, because when we learn more about health economics, we actually understand that health is also a kind of economic activity, and it is a market where private insurance, then public insurance, the demand for the health services are all discussed, and these are all related to economics, and got to learn everything about this health economics. Why certain things, like why there is high demand for the health facilities when it is free, when there is insurance, why moral hazard has been created, how the resources get wastage. And apart from them, that we also discussed about the decision for optimum health care, then adverse selection and moral hazard. I don't have any differentiation, but I have enjoyed all the topics, I would like to say. So all the topics are interesting now. And the next question is how this model has contributed to my understanding on the subject matter. Like this, it's mainly about health economics, as mentioned earlier. So by learning health economics, I came to understand the dynamics of healthcare system, the works, the efforts put on by the physicians, the relationship and the dynamics and the relationship in the hospital industry that are all required to function the hospital very well. And there is also a presence of equity and efficiency trade-off in health market as well. So all things are actually will be a background for my understanding of higher standard level of health system, which probably lies in its base like the economic system. So there are concepts such as physician-induced demand, then medical arm race. These are all happening in the health system, but as we are not really touched with the health unless we get sick and visit the hospital, but everything these things are happening in the health system, and I came to understand that why such things happened. Like there is also application of monopoly system in health in order focusing on innovation and incentive, but at times due to competition, medical services ended up investing in too much in technology, that it leads to over utilization of resources and wastage as well. And physician-induced demand is a kind of a monopoly system where a demand that is not required has been created, and these are all the deviation from the equilibrium when need is not met by requirement is not met by what is given to the people. So these are some of the aspects taught by health economics.